coming up on Network Africa. After almost 4 months, Uganda declares its Ebola outbreak over. Rwanda makes U-turn on Democratic Republic of Congo refugees. Plus, Ethiopian Tigray rebels hand over heavy weapons in line with ceasefire agreement. Hello everyone, welcome to the program. I'm Joke Rogers here in Lagos. Uganda has declared an end to an Ebola outbreak that killed more than 50 people. The announcement follows a 42-day period without any new confirmed cases. The outbreak, which began last September, caused particular concern as it was caused by the Sudan strain of Ebola, for which there was no vaccine. Cases were initially concentrated in the central region districts of Mubende and Kasanda, where the outbreak began. But the epidemic seemed to be getting out of control when positive cases were recorded in at least 7 other districts, including the capital, Kampala. Let's get more on this. We're joined on the program by Halima Atumani, a journalist in Uganda. You're welcome to Network Africa.
Thank you for having me. Hope you can get me clearly. Sorry, I'm just coming back from Uganda.
Yes, certainly. So the Ugandan government waited for a 6-week period before the official announcement. Is there a reason for this particularly long wait?
Yes, there was a reason. Now, what the government did was it had to wait. It had to follow the Ebola clearance protocol. And this states that before they announce that they are Ebola free, they have to wait 42 days from the last discharge of the last patient. And so that explains the 6 weeks that the government had to wait for it to make the declaration today that Uganda is now Ebola free.
So it's usually stressed that this outbreak was caused by the Sudan strain. In what ways was this different from any other strain?
Well, I think one of the most obvious things that is different about this strain is the fact that, one, we still do not have the vaccine. Then two, there is still no known cause, known source for the Ebola Sudan strain. And I think today the minister in her words, when she did make point to that and said they are still trying to find out the source of this outbreak. And once they eventually get to know where this came about, then eventually they will let us know. But also remember that this is the 5th strain. I mean, this is the 5th outbreak of the Ebola Sudan virus strain in Uganda. Uganda has had several outbreaks, but this particular one, I think, has been extremely complicated. I think the last one killed way more people, about 150, which happened, I think, in the northern part of the country. This one was killed 55 people. It happened in central Uganda. And again, one of the questions that I think researchers are still also working on or trying to figure out is why do the outbreaks in Uganda always happen in the months of between July to October? You know, so there's so many questions. And I think if they do not have the answers, these are questions we've been asking and we're wondering, why do we not know the cause, the source of the Ebola strain until today? And the health workers themselves have no explanation for that. So I guess, I don't know if that answers your question, but I think there are so many more questions that still remain with this strain.
Halima, so what happens now? Do Ugandans go back to business as usual, or will some precautionary measures be put in place to guard against a reemergence?
Well, definitely the minister, the government, the Ministry of Health is cautioning Ugandans, telling them, please watch out, be vigilant. You know, someone could present with symptoms just because we've declared today that the country is Ebola free does not mean we are out of danger. So yes, Ugandans have been urged, but of course that is the part of the ministry they are going to caution. But believe me, on my way driving back here into the city, life is back to normal. A few schools have already opened. I do not think they're really following all the precautions. If you look around, life literally is back to normal. Maybe the only thing that will probably shake Ugandans again will be COVID. But for now, I'll be honest with you, life is back to normal. It's business as usual. Of course, it's only when you go to functions organized by the Ministry of Health that, people say, oh, I'll not shake your hands, or I'll not hug you. But if you come out to the general public, the general community, it's still the same.
About neighboring countries, are there concerns that there could be a spread to neighboring countries, even though Uganda says that it's free and there are precautionary measures within Uganda itself? But what about countries surrounding Uganda? Are there concerns that this could spread to other areas?
When the Ebola outbreak was announced in Uganda, I think WHO was tasked to look for about $6 million, if I'm correct. I think that's what the regional director did mention today, and say that they were tasked to look for $6 million. And that was not just money that was given to Uganda, but also to try and give to neighboring countries. And I think there was a time when neighboring countries came, about 8 countries in the region, including Kenya, Tanzania, DRC, which is also one of the major places where we have outbreaks of Ebola. We had South Sudan, and Rwanda and Burundi, all countries within the region. And many of them were worried. But for now, I think the assurance is, since now Uganda is clear, there is no need for neighboring countries to worry about an outbreak, unless, of course, it happens. And it's probably going to be a new source, but not necessarily from someone who came from Uganda. Because according to the minister today, any known chain of infection has been interrupted. That's the announcement that Uganda is Ebola free. So that means our neighbors should have the confidence and be rest assured that there will not be any cases of an outbreak in their countries stemming from Uganda.
So is the government talking about any survivors and perhaps the condition they're in currently?
Well, I did speak to some survivors myself today, and they were there. They attended the meeting, and I think for many of them, it is a surprise. It's a relief that the disease is over. But I think that this particular lady that I spoke to told me, when she told me, when I asked her how she got the disease in the first place, and she told me, well, when I got the disease, I actually went to visit a sick relative. Upon arrival, 3 days later, I get all the signs. I'm coughing. I have my nose is bleeding. I have diarrhea. I am vomiting and everything. And I quickly called the ambulance. But as soon as the ambulance came, that was the last time I remembered who I was or where I was. And she said, I lost my consciousness for 3 weeks. And when I regained it, when I woke up in the hospital bed, all I heard were people saying, welcome back, welcome back. And she tells me at that moment, that's when I realized I was literally among the few who survived the outbreak. And she told me it really, it broke her. One, she said she's a mother of 3 children. She owned a small boutique. Never mind that it was in the village, but, it was to certain standards. She was a lady who was able to take care of herself, take care of children. But what state is she in now? She tells me, right now, I struggle. I was thrown out of the house because I could not pay rent. My children had to be taken away. I literally beg for food just to eat and survive. So survivors are there. They are struggling to make ends meet. Whether the government is going to come up and support them, that's another question. But yes, the survivors were there. I remember we had 143 confirmed cases, 55 deaths. That means there were about 88 survivors. But of course, those who came in today were not 88, but there were quite a number who came in, and they were happy. They were happy that they were among those who survived. But what their lives are now is not what their lives were before they were sick. These were people who were able to provide for themselves. These were people who were able to take care of themselves. but right now they're living hand to mouth because, the disease changed their lives. And one thing that I think as journalists, probably as media, that we probably will need to think about, or maybe it's a story that we'll need to follow up. I remember the survivor that I spoke to, when I asked her, do you remember when you were in the hospital? And she says, you know what? I should remember, but I don't remember. So I asked her, why don't you remember? And then she said, I think to a certain extent, I have not regained my memory, my abilities to use my memory very well. I do not know if it's an effect of the disease or not. So she doesn't remember certain things.
Wow, what a story. And, talking about their experiences post-Ebola, the survivors, any form of stigmatization? Do they see people, try to move away from them when they see them, knowing that they just, had a bout with it?
Well, from the survivors, they did state that. I think that this happened mainly a few days after they came back from hospital, and the lady was telling me it was difficult. Like if she was walking in the village, before she gets there, people would already know that she's coming. How our villages are quite small, so everyone knows everyone, and everyone would know if Halima had Ebola, then the whole village knows Halima had Ebola. So that's exactly what happened to her. And she said, in the village, we struggled with stigma because no one wanted to come next to us. She was like, I had a boutique. We're coming to the Christmas season where I would think, people are going to come to my shop to do shopping. And she said, no one was coming because they probably thought I was going to infect them through the money that we are sharing, or maybe through, them buying stuff from me. No one was coming. But all we know is that every time we walked within the villages, people, like everyone would know she's coming here. She's almost getting here. But eventually, I think through community engagement, now one thing that they've done for themselves, that they've started up an association where they support each other. In Uganda, a survivor is known as Cow Now. So it is called the Cow Now Survivors Association, literally meaning survivors, who beat Ebola. I think it's called Kesa, Cow Now. Cow Now is a Uganda word for survivor. And now any Ebola survivor that you would meet, if, for example, they were called Halima Athmani, now they are calling themselves, when you ask them what's your name, they say, I am Halima Athmani Cow Now.
Right, Halima, thank you. That's where I'll have to leave it today. Thank you so much for that update on the Ebola situation.
You're welcome.
In Uganda.
You're welcome, and thank you for having me.
Still ahead on the program. After protracted battle over salaries, nurses in Zimbabwe now face jail if they strike again. Details in a moment. Welcome back to the program. Health experts and scientists have cautioned South Africans that it's too early to panic over the new COVID-19 Omicron subvariant. The so-called Kraken variant has been confirmed in 28 countries, and the World Health Organization says it's the most transmissible subvariant to date. South Africa's Health Minister Joe Phala shared a Zoom presentation on details on the new variant and why people should not be worried so far.
The Genomic Surveillance Unit at Stellenbosch University, which is a member of the Network for Genomic Surveillance, reported the detection of XBB.1.5 subvariant from a specimen which was obtained from a patient on the 27th of December 2022. We believe that the fact that the dominant variant of concern in China and in the world remains the Omicron, and that the immunity of South Africans from vaccination and natural immunity is still very strong. This puts us in a better position and in less risk. And that is why we have not seen up to this stage any major changes in our epidemiology in terms of the rates of infection, also in terms of admissions to hospital, and even the rates of fatality from the COVID pandemic. We have consulted our ministerial advisory committees and also WHO, the World Health Organization in Geneva, and also the regional office in Brazzaville. And in both cases, the advice that we have received is that there is no need to impose any travel restrictions on any country, including People's Republic of China.
Moving on, Rwanda's government has walked back on President Paul Kagame's stance that the country will no longer offer refuge to people fleeing conflict in the Democratic Republic of Congo. Mr. Kagame had said refugees fleeing across the border into Rwanda were not Rwanda's problem. But in a statement last night, government spokesperson Yolande Makolo said Rwanda had no intention of expelling or banning refugees. She accused the media of misrepresenting President Kagame's remarks. She insisted that the president addressed what was the blatant hypocrisy in criticizing Rwanda, which simultaneously gets the blame for state failure in the DR Congo and is then expected to accommodate those who seek refuge from the consequences of that failure.
In a renewed offensive by the Tutsi-led rebel group. The government of Congo, Western powers, and the UN.
Well, the spokesperson for the rebel Tigrayan forces in northern Ethiopia says they have handed over their heavy weapons in line with the ceasefire agreement signed in South Africa in November. Getachew Reda wrote on Twitter that the transfer had been confirmed by an African Union monitoring and verification team. The move is central to the agreement, along with services being restored in the war-torn region where hundreds of thousands of people were killed. Another condition is the withdrawal of Eritrean soldiers who fought alongside the Ethiopian government. Reports from Tigray suggest the troops are still there. Back in Nigeria, the Health Facility Monitoring and Accreditation Agency, HEFAMA, in Lagos has announced the outsourcing of monitoring of health facilities in the state to 8 private organizations. The chairman of HEFAMA board, Dr. Yemisi Solanke Akoya, disclosed this at a news conference in Ikeja. She says the objective of the exercise is to increase the monitoring coverage of health facilities so as to ensure improved quality of healthcare delivery to the residents of Lagos State.
Lagos State has 326 primary healthcare centers, 28 secondary health facilities, 1 state-owned tertiary healthcare center, LASUTH, and 3,974 registered private health facilities catering to its population of over 20 million residents. As part of its health sector reforms, the state government is paying particular attention to maternal and child care with the provision of facilities for that purpose detached from existing hospitals. To also ensure the safety of Lagosians visiting any private hospital, the Lagos State government, through the Health Facility Monitoring and Accreditation Agency, is outsourcing the monitoring activities of HEFAMA to private organizations for better healthcare service delivery.
The objective of the outsourcing is to increase the monitoring activities in Lagos State as required by the law to ensure that we do indeed have improved quality of healthcare in Lagos State.
According to the agency, only registered health facilities will be permitted to operate in Lagos State.
3,974 as at today registered private health facilities. We can only know the number of facilities that are registered because we have several out there that are not registered and so not accounted for, and that is one of the reasons why we do monitoring to ensure that it's only facilities that are registered that can practice in Lagos State.
We are going to have a health monitoring tool that they're going to use during the assessment of these private or public facilities. Also, we're asking them to have a camera, a body camera, that's going to record all that is going on. And in addition, they're supposed to fill and complete their assessments daily so that we can evaluate what is going on.
8 private organizations have been selected to monitor health facilities in Lagos, while EFAMA remains the accreditation agency for hospitals and will work closely with the organizations to ensure quality healthcare service across the state.
Well, staying with healthcare, this time we move to Zimbabwe, where healthcare workers have been banned from striking for more than 72 hours, with organizers risking up to 6 months in jail, according to a new law. Those who defy the striking ban risk disciplinary action as well. The Zimbabwe Association for Doctors for Human Rights said that the new law was draconian and will push more health workers to seek employment abroad. Zimbabwean doctors and nurses have often gone on strike over pay, shortage of equipment, and medicine. That's Network Africa. Thank you for watching. I'm Joke Rogers.